As we were working with U of L on the COVID-19 sampling of wastewater sites.
We did something very bold, and that was to go and divide up the city into 17 catchment areas.
And in those 17 sites, they include our 5 water quality treatment centers, then 12 sites that were randomly selected based on U of L's co-immunity project that allowed us to do sewer tracing to make sure we got a good representation of the community.
And that would give us an understanding then of how the virus was seeding and spreading, and we could see it visually over time because we were capturing it at the sub-county level.
They would send us some locations, and us knowing the collection system, we're able to say, no, this isn't a good site.
We really needed the expertise of MSD to help us understand the very complex network of pipes that we have in the city.
So we set the machine up to based on pulling over a certain period of time and a certain amount of sample, and it pulls it up over a 24-hour period. And the reason you want to do that is it'll give you a true representation of what's going on throughout that whole day in the community. You got to think people go to work, then they're back home, so you want to get that true snapshot of a full day. So when we deliver the sample to U of L, temperature makes a big difference in terms of the results they'll get.
At our labs here at U of L, we actually essentially filter it and then work to find the substrate that we can get the RNA, the virus, the very specific virus for SARS. And then we go and essentially count up how many copies of that virus that we find. So the process, except for that front end, is exactly what happens with clinical nasal swab testing. It's just we have to get rid of the sewage first. And what we have seen is a correspondence, right? There's definitely a high correlation between what you'll see in wastewater levels of virus and the number of community infections that you'll see. The thing that's really special about this relationship is we also can see patterns within the county. And there are many places in Louisville that are just constantly high sources of infection when we look at the sewage. And you wouldn't have been able to do that looking at the clinical case data. It's very difficult to reconstruct places reliably from zip codes and the kind of information that we're used to looking at clinically. We really saw underserved communities that have less wealth, less resources. Those communities, tended to have higher infection rates that we could see in the wastewater. And in our city, those are areas that are west and south and southwest. And then when the vaccination program rolled out, we saw a similar kind of enhanced view of our community. So the wealthier parts of our community immediately had wastewater levels drop, the virus levels in the wastewater drop, and parts of the community that weren't getting fully vaccinated at the same rate continued to stay high. And we see this now with the variants extremely well. When you see that, you have a whole different way of understanding vaccination and the role vaccines play. I see it as playing a proven role at this point in time, and I really wish that we wouldn't have to have any more infected people. And so we have complementary skills, right? So MSD has some great engineers who really know the ins and outs of how safe sanitation works, and they're deep experts, right? And then we have experts in laboratory methods and epidemiology and all this. And I promise you, the two things together are extremely powerful, because we get the collective benefit of all of our expertise. And I think MSD, from my perspective, from the University of Louisville, is a model kind of a collaborator, right? Like somebody who's not just a partner, like thanks for showing us where the sewers were, but rather is contributing to the problem solving and the design and all of that.